The Steps Hip Spica Care DVD is made for parents and carers of children in hip spica casts. They are a series of mini videos which cover aspects of looking after a child in a cast. The videos are examples of how real families coped with everyday tasks of looking after a child in a hip spica. They are not meant to be fully comprehensive and cannot tell you everything you will need to know about hip spica care, but hopefully they will reassure you that solutions can be found to many practical problems. Remember that it is best to contact your healthcare professional if you have a problem you cannot solve. Parents, carers and healthcare professionals have reviewed these videos.
Cast Care Checklist. You will need to contact your hospital for advice if any of the following occur. The fingers or toes turn white or blue and feel cold to the touch.
Spica Care DVD
the fingers or toes become swollen and do not return to normal when the limb is raised. Your child complains of feeling pins and needles, numbness or pain.
In a cast.
There is any oozing or wetness under the plastic cast which is not from nappy leakage. There is a strong, unpleasant, localised smell from the plastic cast, especially if your child has a fever.
They're not meant to be fully comprehensive.
The plastic cast becomes loose, cracks or breaks. The skin underneath or around the spica is looking red and sore,
they will reassure you that solutions can be found to many practical problems. You can view each video separately
when they're at
by
this
going
age,
to the menu section of the DVD.
Like to put things down there.
Remember
so what you need
that it is best to contact your healthcare professional if you have a problem you cannot solve.
She likes playing with like big
Parents, carers and healthcare professionals have reviewed these videos.
So, and she will put things down there. And again, really checking for sores as well. We've actually put some plaster around there ourselves because this was rubbing. So you tend to check areas like this, and again on the ankle area there, that can get quite sore if you're not careful. You've got to make sure that's all nice and dry before you put any clothes on it, and then you don't get any sweated areas. If it's very hot, we tend to give her time to actually play just like this as she is.
This is the plasters out that we put around Bethan's plaster, so the sponge. We got this from the hospital, and we've been told by the specialist nurse that if we run out, the best thing to do is just to contact her and she'll send us some through the post because it's difficult to get hold of yourself. And you cut it down to whatever shapes you need. Right, so one of the things that's started happening the last couple of weeks as Bethan sort of gained confidence and been moving around a bit in her plaster is that these foam bits keep rolling back. And you can see this is what happens. So we have been replacing these sort of once every couple of weeks because they can get a bit soaked with urine if there's any leakage. But what's happened more recently is that they keep rolling back because of the fact that she's moving about a bit. So I've had to stick extra bits to try and stop the main bits which are protecting the plaster edge from rolling back. So it's started to look a bit more like a DIY makeshift foam replacement.
Sometimes you might find it actually easier to get hold of Sleek, which is a waterproof sticky plaster, and you use it in the same way as you would the plasters out. If you look at these examples and you put it around the edges of the plaster where the nappy goes and other edges that could be sharp like the ankles and the tummy. These are some examples of different shapes of plasters. Casts obviously do become a little smelly. If it becomes a problem, you can actually use special deodorant products. You can get these from chemists, or you can ask your doctor for special stoma patient deodorants. Remember to be very careful though when you're putting them anywhere near your child's skin.
When Amelia was in her first cast, when she was about 7 months old at the time, when she was in her first cast, halfway through the first cast, unfortunately she got chickenpox. And as you can imagine, in a cast with chickenpox, that wasn't very good. And she did get horrific diarrhoea with the chickenpox. So consequently, it did damage the back of the cast, and I was worried that this cast was going to, come away and not be structurally strong. So when I rang the hospital up and mentioned this to them, they actually had her in hospital pretty soon, within a few days, and they changed the cast. And although she got chickenpox, they put her in a side room where she would be out of the way of the others. But they said you couldn't catch it at that time because obviously the spots and everything were out. So and they actually, she was in a side room, and they actually changed the cast because it had become smelly, and that's just what diarrhea in a cast just don't go together. So that's another little story.
Remember, you are not alone. When you want information, advice and support, our helpline team are here to help you. No matter how big or small your concern, please email or telephone our helpline. Get instant access to information 24 hours a day via our website, where you can download our advice leaflets. You can also visit our online chat forum, which provides a fantastic resource of helpful tips and practical advice written by parents who are coping with a child affected by hip dysplasia.